The 340B program is a federal drug pricing program that was enacted in 1992. And what it does is it has the manufacturers that are a part of the Medicaid drug rebate program sign a pharmaceutical pricing agreement. That agreement states that manufacturers that have covered outpatient drugs may not sell those covered outpatient drugs greater than a statutory ceiling price to certain covered entities or organizations that are involved in the 340B program. So these 340B discounts provide these covered entities resources to provide medication access to their most vulnerable patients, as well as other community benefit services and activities to take care of these vulnerable patient populations. Apexus has served as the 340B Prime vendor for 13 years now, and one of the primary goals of the Prime vendor is to improve access to discounted medications to the covered entities and their patients. And we do that through a variety of ways, primarily through contracting, by providing further discounts on covered outpatient drugs and value-add products for these covered entities. We have multiple stakeholders across the 340B space, and so we have a responsibility to meet the needs of all of these stakeholders, whether they are the covered entities and their patients, manufacturers, distributors, trade associations, vendors, consultant firms. Apexus serves as a trusted partner for this network of different types of stakeholders by really being a balanced and neutral focal point that constantly provides different types of education, contracting, technical assistance, and any type of support our stakeholders may need. When the 340B program first began, smaller clinics and rural hospitals, for example, had a really hard time accessing 340B discounts through their distributors. And so Apexus, as the Prime vendor, created a distribution network of all types of distributors, whether they're regional, national, specialty. And what that does is it helps improve access to 340B discounts, whether it's the ceiling price or on products that we have Prime vendor program sub-ceiling pricing for. And for this reason, it becomes really easy for a covered entity to be able to access these 340B discounts from their regular distributor. The 340B program already calls for steep discounts from manufacturers, and so Apexus, as the Prime vendor, really takes it a step further and provides further discounts on those drugs by contracting with our supplier partners. Some of the areas in which Apexus contracts include sub-ceiling. So this is a way for Apexus to negotiate sub-ceiling pricing, which is lower than the ceiling price, to covered entities on brand and injectables. We also have value-add contracts, and these are contracts on things that are not covered outpatient drugs but are certainly needed by our covered entities. These things include vaccines or blood glucose monitoring supplies or point-of-sale test kits, etc. So these are the areas in which we can provide further discounts and bring more value to the covered entities and their patients. Apexus offers extremely helpful resources for covered entities to ensure that they are utilizing contracts that are available to them and that work for their organization. One of the ways we do that is we have a Prime vendor program secure portal. So you really don't have to reinvent the wheel. There are a lot of reports and resources available to you through this portal. Once you log in through this portal, there are various types of reports that can be instrumental in determining purchasing decisions. For example, there's an opportunities report that lets you know different products that are available to you that have not been purchased under contract. And this allows you to know that a product might be at your disposal that you may not have taken advantage of. There's also the contract catalog. And so this catalog is essentially a list of all of the contracts that are available to you through Prime Vendor Program contracting. So again, this just gives you an idea of what contracts are available to you and will help you make formulary decisions through your P&T committee, as well as purchasing decisions, especially during shortages. Apexus integrates compliance in everything that we do and makes that part of every decision we make. We support compliance in different arenas. First off, with our distribution and supplier contracts, we're able to ensure that we are working with our partners to create an infrastructure that ensures that the movement of 340B drugs, whether it's from purchasing or the delivery of the 340B products, are done in a compliant manner. We also provide various different education offerings, and these education offerings are of course HRSA aligned and ensure that we are providing compliant and operational information to maintain the integrity of the program. And it's important to realize that the education are customized for different stakeholders and different audiences, and this ensures that all of the individuals that impact 340B compliance are receiving a certain level of knowledge. Further, we provide technical assistance through our Apexus Answers call center, and this is a really important way for Apexus to relay and communicate HRSA policy, HRSA positions to the stakeholders that need to implement the 340B program. Education in the 340B program is absolutely essential to maintain the integrity of the 340B program. And the 340B program is touched by so many different types of stakeholders. So ensuring that we get education to all of our stakeholders in the 340B community is very important to us. We do that in several ways. 340B University is a live education offering, and one of the benefits of that offering is that you have an opportunity to network with various other attendees from different stakeholder groups. The 340B University is taught by faculty that are subject matter experts in covered entities, manufacturers, and wholesalers that can really share real-life experiences and perspectives as well as best practices. The 340B University is usually a full-day event and provides that foundational level of 340B knowledge with the opportunity to network and learn from best practices across the country. 340B University On Demand is another very important offering. This provides the same level of foundational knowledge, but it's on demand, it's online, and you can provide that level of training to anyone at home without having to travel to 340B University. This has really been a program that's positioned to be integrated within your onboarding programs within your organization, so it's a great way to train individuals that are just joining your organization and needing that baseline 340B knowledge, and it's a great way to provide continuous education for individuals that need refreshers on 340B program. HRSA writes frequently asked questions, or FAQs, to help provide insight on operational questions and policy questions to stakeholders. One of the things that Apexus does is that it houses the FAQs so that we can disseminate the FAQs to the stakeholders across the country. And so covered entities, manufacturers, consulting firms, and all of the stakeholders in the 340B community can reach out to Apexus, use our website to get a hold of these FAQs to help them get insight on HRSA's position on specific situations. And this becomes extremely helpful when you're operationalizing the 340B program because they really cover the more detailed information that you would need for implementation. There are different levels of FAQs, and because the 340B stakeholders are so different and the covered entities are so different, some of these FAQs are internal only and are not posted on the website. The reason for this is we don't want the FAQs to be misunderstood and misutilized in implementation. All of these FAQs, whether they are internal or on the website, are always available to all stakeholders. If you just call the call center, we can make sure to provide you the right FAQ and provide you with some background on the FAQ so that it's utilized correctly. Apexus also offers other resources and tools. On our website, we have toolkits, and these toolkits are documents that you can download from the website and use to help you operationalize the 340B program. Some of the most popular toolkits we have are policies and procedure templates. We have customized policy and procedure templates for different covered entity types, and that way you're not reinventing the wheel and you have a place to start. Another really popular toolkit are the self-audit toolkits. We have these for the various different practice settings within the 340B program, whether it's the mixed-use setting for hospitals, contract pharmacy settings, etc. So these are definitely recommended to use for your operational experiences, and these are things that are aligned with HRSA-supported policy. I've spoken to hundreds of stakeholders in the 340B program, and everyone I've spoken to really has the intent to maintain the integrity of the 340B program. One of the greatest obstacles in doing that is education. Education for all stakeholders really becomes important to be able to understand the policy requirements around the 340B program, how to operationalize those requirements and audit those requirements to make sure that you are operationalizing them correctly. And then, most importantly, to be able to bring the 340B community together to share best practices so that those best practices are recycled and utilized in a compliant way. The Apexus Answers call center provides free technical assistance to all stakeholders. This call center works very closely with HRSA to ensure that all HRSA policy is communicated to any stakeholders. So anytime HRSA has updates or changes, this is a way to get the most up-to-date and accurate information when you have questions to operationalize the 340B program. The call center is equipped to answer all levels of questions, whether they're basic for registration periods, all the way up to the most complex gray areas in terms of policy and implementation. We have a tiered level of support for those types of inquiries. The call center handles the questions initially, and if it's a question that they can't handle, it's escalated to a team of field-based pharmacists that can tackle more of those operational compliance questions. We also have the ability, with our partnership with HRSA, to escalate questions to HRSA in a de-identified way. So everything you ask is confidential, but at least that way you're able to get information directly from HRSA to answer your question. Industry associations play a critical role in the 340B community. And as Apexus, we've really collaborated with a lot of these associations to make sure that we're constantly in tune with what their membership needs are around the 340B program. We have all types of partnerships with industry associations, and those partnerships are different in terms of the type of resources that we're able to provide to meet the needs of their constituents. Some of those organizations include ASHP, APHA, AIM, 340B Health, NAC, among others. Globally, we serve as subject matter experts for the 340B program so that we can equip the associations with resources, customized educations, and tools so that they can provide their membership with the value and education that's needed. We also use the association's partnerships as a way to inform us of what the membership needs are so that we can better inform our tools and resources and meet the greater need of the 340B community.